And I'll begin by having them each introduce themselves, just give us a couple lines about where they practice, and anything else that they would like for us to know about them. In alphabetical order, beginning with Dr. Robert Goldberg.
Thanks. I'm Bob Goldberg. I'm at UCLA at the UCLA Stein Eye Institute. I'm on the faculty here. My subspecialty is actually ophthalmic plastic surgery, which is an interesting subspecialty. And medical students are sometimes amazed to hear that ophthalmology has 7 or 8 subspecialties, and many of us are practice limited, so the eye is not small enough. We divide it up into littler pieces. I have an academic private practice. I teach residents and fellows, and maybe of interest to you, I'm also the chair of the resident selection committee here, a process that's going to be starting for us next week. I'm glad to answer any of your questions and tell you more about our field.
Fantastic. Thank you so much. And also Dr. Sarwat Salim.
Hello, good evening, everyone. Thank you for the invitation to be part of this panel discussion. It's really an honor to join you guys today. I'm Sarwat Salim. I'm a professor of ophthalmology and director of glaucoma service at Tufts University School of Medicine in Boston. I also serve as the vice chair for clinical and academic affairs. My career journey has been academic medicine, and I look forward to entertaining all your concerns and questions tonight.
Fantastic. Well, I'd like to kick things off with a question for each of you to answer in turn. And it's pretty simply, why did you choose ophthalmic surgery as your specialty of interest? And really, at what point along your journey did you develop that interest?
So I'm glad to start that, Vanessa. As an undergraduate, I did psychobiology, and my undergraduate research was in visual processing. So I was a little bit tuned into the eye from the beginning. But I looked at all the medical specialties, and like many of you, I was sure that when I was on each rotation, that's what I wanted to do with my life. They were all really fun. Although I was certainly a little bit biased and drawn towards all the surgical specialties in particular. Ophthalmology, though, really drew me in, most of all because of the ability to combine research and clinical care, I think perhaps more than in many specialties. And there's 2 reasons for that. First of all, ophthalmology, perhaps more than some specialties, can be substantially an outpatient specialty. And so it allows you in an academic environment to have, academic days where you're not rounding on inpatients. And actually, Vanessa, in plastics, which I went into, we actually have by far the busiest. I'm looking across at the hospital. We have 2 patients to round on tonight. So we actually have a bigger inpatient service than some. But in general, ophthalmology allows some segmentation of time, which is very beneficial if you're trying to be a clinician scientist. Because if I have a research day where I'm in the laboratory, it's not common to end up being called away for emergencies. And the other part of that equation is that the eye is such a great model for so many research questions. It's a microcosm of the entire body. It has immune privilege status. It has high vascularity. It responds exquisitely, too exquisitely, right, Sarwat, to immunologic diseases. And in general, we have really good tools to look at the eye. You can see into it. You can see the vessels. You can actually see the nerves nowadays. Our imaging is quite incredible. So it's a great model for studying a lot of different diseases. And lastly, I just think I felt so privileged to be able to help patients with vision. Patients so often report in questionnaires that their greatest fear in life is the loss of vision. Certainly something that it's very uh, emotional and powerful experience having eye problems. And so I think the privilege of being able to intervene and often help patients, restore or keep their vision was a very powerful motivator. So I guess, Vanessa, those are sort of the three main areas that drew me into ophthalmology.
That's fantastic. It's clear that you've been asked that question in the past. Dr. Salim, what would you say? What brought you into the field of ophthalmology?
When I was a medical student, I loved internal medicine. I was so intrigued by pathophysiology. But as I was reading about it, as I was doing my rotations, I felt somewhat limited. We would take care of many patients with chronic diseases, but we couldn't cure those diseases. And that's what then caught my attention in terms of surgery, because I wanted to fix things. I want to use my hands. So for me, ophthalmology was a very natural choice because it's a beautiful blend of medicine and surgery. Medicine is a very noble profession, and one makes meaningful contributions in every discipline of medicine. As an ophthalmologist, I feel extremely grateful and humbled to give someone the precious gift of sight to live a richer, fuller, and more productive life. That was my main reason to go into ophthalmology, so I can make that difference in someone's life. I am a glaucoma specialist. As Dr. Goldberg was saying, within ophthalmology, we have many different subspecialties, and glaucoma is one of them. It is a chronic disease. Many patients I see every few months, so I am able to develop long-term relationships with my patients, which I enjoy very much. And having a career in ophthalmology also allows me to do international outreach work. And that's something I knew very early on in my career that I wanted to do. I wanted to travel, I wanted to reach under-resourced areas and indigent patients. So throughout my career, I have partnered with many different organizations, such as the American Academy of Ophthalmology, Orbis International, IMC, World Cataract Foundation, and I have been doing international work where I go, I take care of many patients, I do surgeries, but I also do a lot of skills transfer to empower our colleagues internationally and trainees so they can continue the delivery of care in their respective areas and countries.
Wow, fantastic. I wanted to follow up on that with you because my impression, and this is from the place that I sit from a general surgery background, but I believe that we're seeing an increasing number of students and trainees that are interested in this global surgery focus. And so I'm curious if that's something that played into your decision to pursue a career in ophthalmology, that there were those opportunities, or if that's something you came to later. And what does that look like going forward to those that may have an interest in the field of global surgery? How does that play in with ophthalmology?
So I agree with you. There's definitely increasing awareness and interest in global ophthalmology or global medicine. One advice that I would like to give to our listeners on this webinar, I think in order to provide services outside globally, one should wait and become a more experienced surgeon before you go. I always discourage my residents and fellows to just go just to get experience. Because when you travel and when you go to these underdeveloped areas, sometimes equipment is not ideal. The staff is not properly trained. Therefore, I feel one has to be a very experienced surgeon before taking that responsibility. But it's a wonderful way to give back. And I totally agree with you that now when we are reviewing residents' applications, almost everyone talks about having an interest in global medicine or ophthalmology. But I think it's wonderful that there is so much interest, and I commend and I actually encourage younger residents and fellows to do that.
Wonderful. I think you both had touched upon the fact that there are many subspecialties within ophthalmology. And so you've each described your own, so ophthalmic plastic surgery and glaucoma, but what else is there?
So another subspecialty is cornea. And in that subspecialty, as you know, many people get refractive surgery. So they want to wear glasses. So the excimer laser is used to do photoablation of the cornea. There's retina, there's uveitis. Uveitis has a very strong association with internal medicine because many autoimmune diseases can have ocular manifestations. So we have many, within the eye, we have many different subspecialties. So it's quite interesting organ.
Absolutely. And then Dr. Goldberg, I wanted to follow up with you specifically. You had touched on the fact that in your practice, or maybe not in your specific practice as you have 2 inpatients currently, but that in ophthalmology in general, that it's a lot of working with patients on more of an outpatient or ambulatory basis, and how that can facilitate research. So do you find that a majority of candidates for ophthalmology training are interested in research? Is that something that's mandatory? How has that manifested for you? I know you talked a lot about your own research. I'm sure that the audience would love to hear a little bit more about how that has shaped your career.
So it's certainly not mandatory to do research. You know, we're thinking a lot about the selection process now, that there's not an emphasis on board scores anymore. Medical school grades are becoming more and more uniform. When half or 2/3 of the class gets honors, it's, you know, doesn't really differentiate the students that well. So we think to ourselves, you know, how do we look for excellence in the applicant pool? And what we're looking for is passion and leadership. Many medical students demonstrate their passion through research. And that's always been one of the most common ways that you know, that someone's passion for a field is reflected in their application. And I think it's just so accessible, right? Because, you know, medical students are in the midst of these academic and, you know, institutions and surrounded by faculty that are hopefully passionate about research, and they pick that up. So it's a very accessible way to get to know faculty, to get to know the field, and to make a contribution with their own, you know, with their own creative ideas. But I certainly encourage that for students, because I think that, you know, it is a great way, a great introduction to any field, you know, is to work with faculty on research. But it's certainly not a requirement. And, you know, other students have demonstrated their passion and expertise in, as Sarwat said, international care, or something I personally prefer, which is local care in underserved areas. You don't have to travel that far in Los Angeles to find underserved communities that really need help. Or entrepreneurial activities. You know, there's just so many different pathways to distinguish oneself. At a center like at a program like ours, which is a highly academic program, I would say almost all the applicants have done some research, because it's one of the things that we in particular look for here, since we're trying to train academic leaders in a program like this, people that want to make a contribution and contribute to the field. So that was an awfully long answer to your question. I guess the short answer is that it's common to do research. I think it's a very good pathway to get exposure to the field. It's something that particularly the strong academic programs are attracted to in an applicant, but it's certainly not mandatory.
Okay, thank you very much. I'm going to take the liberty of asking a question that I don't know that I should be embarrassed, because I would like to tell myself that there are many that shared this confusion, but help our audience understand the relationship between ophthalmology and optometry. And is that something that you're seeing more interprofessional collaborative practice these days, or how do those relationships work?
So I can start with that, and I'm actually interested in Sarah Watt's opinion also. The two specialties compete economically, but I think collaborate in terms of patient care. And so I think that you're right, Vanessa. Overall, there's been, I think, a tendency towards more collaboration. And as ophthalmology practices, like all of medicine, start to congeal into larger practices, it's very common for a large ophthalmology group to include both ophthalmologists and optometrists. I guess I should step back for a second because it occurs to me, maybe in the level of confusion, people don't even understand the difference. So optometry is a 3-year program after college, focusing mostly on making eyeglasses and some diagnosis of basic eye disease. There's no specific surgical or medical training in optometry, although some optometrists in some states are starting to get some privileges legislatively to do that. And that may change over time in the specialty. I think the specialty politically would like to have more privileges to prescribe medicines to do surgery. But in most states, that's not legal. In California, optometrists can't do surgery, and their ability to prescribe medications is pretty limited. So traditionally, the role of optometry is in prescribing eyeglasses and basically diagnosing basic eye disease, serving as a little bit like a physician assistant model, in the sense that they work alongside the physician, doing some of the intake, some of the triage, but not the higher level care. Did I describe that well, Sarwat, do you think?
Yes, no, you did. Thank you. I would agree with Dr. Goldberg that we work in collaboration with optometrists. We do have different level of education and training. And I think it's important for us to educate our public so they're also aware of our scope of practices. And the main reason is to make sure that we can ensure safety care to, safe care to our patients and surgical care. Things are changing. We are working together. At Tufts, where I work right now, we do have several optometrists employed, and we work very well together. And I think, as I said earlier, it's important to understand our limits, what we can or cannot do. And our optometrists at Tufts, they're very well aware, and they are not going outside of their scope of practice. So all the surgeries are done by ophthalmologists, and they are involved with providing basically primary care services with glasses or low vision services.
By the way, I'll mention that the American College of Surgeons has been very helpful for the ophthalmology organization in trying to ensure patient safety. And there's an AAO program, surgery by surgeons, that the ACS has also supported, because the training is, it's hard to emphasize how different it is. In ophthalmology, we spend 4 years now perfecting surgical skills, doing thousands and thousands of cases and thousands of hours. Optometry in a 3-year program has almost no surgical training. So our strong position has been that advanced care and surgical care really should be performed by a highly trained specialist and ophthalmologist.
Absolutely. Well, thank you for those helpful insights. A question from our audience is, how do you perceive research that is unrelated to the residency of interest? In this case, specifically for ophthalmology, and is that seen as a good or a bad thing? Would you advise for or against it? So if there's an applicant interested, they're applying into ophthalmology, they've done research in an unrelated field, how is that perceived by training programs?
Well, I can start with that because I just read 400 charts. I would say that there's a slight edge when I look at an application to someone who's done ophthalmic research. And that edge has two facets. First of all, I'm more likely to know the people that they worked with. And, application processes are still personal. A letter from someone that I know is just naturally going to bias me more than someone I don't know. Maybe life's not fair, but that's the way we all work. And then second of all, I'm a little bit more likely to understand the research, because it's more in my field. But I'd say, Vanessa, those are sort of soft findings. And I think what's most important is someone who's demonstrated a passion in research by, a focus in a certain area, giving us a sense that this wasn't a project that they just walked into a lab and did a, sort of a perfunctory amount of work, but someone who really, tried to grasp a problem, took it through to completion, perhaps had a focused area with more than one paper or project in an area. And if I see that in any field, it's impressive to me. So a slight edge to ophthalmology research, but certainly not important. And many applicants that I see have distinguished themselves by research in some other field that I find just as valuable in gauging their passion, their work ethic, their energy, and their intellectual capability.
So I agree with Dr. Goldberg. As Vice Chair of Education, I just reviewed hundreds of applications also. And I pay attention to pretty much all aspects of their application. I read every single personal statement because I really want to get to know the person who's applying. I pay attention to other activities such as research, which I think is very important. And as Dr. Goldberg was saying, if it's done in ophthalmology, I think it's a little bit easier for us to understand what they have done and who they have done with. And if they have a letter from that person, a preceptor, then carries more weight. But I think any type of research project is attractive. It shows commitment. It shows going out of your way to do something extra. So I think it's definitely a plus on their application. I also pay attention to community service, many things. It's basically not just, when I'm reviewing these applications, it's just a strong pool of candidates. It's really difficult to decide out of 600-700 applications to invite about 50 candidates and then offer positions to only 4 applicants. It's very, very tricky. But I would just say to the attendees on this webinar, if you love ophthalmology, be bold, be courageous, apply, follow your passion, and it comes through in your application, in your interview. And hopefully at the end of the day, if you're really passionate and sincere, you will get it.
Those are wonderful, inspiring words. Okay, one other question from the audience. Is there a preference for students to engage in clinical research or translational basic science research? Do either of those have an edge?
I think both are fine, depending on the interest of the candidate. I would say most clinicians are probably would prefer clinical research, I would think, because it depends who's on the selection committee. And it's a very diverse group of faculty members on that committee, and not everyone is a PhD or a research scientist. So, but either one I think is fine. It's just having that interest and showing that you've done something extra. You've done some scholarly work, and I think that really carries weight to your overall application.
Yeah, I agree completely. I really don't think it makes any difference to me. What we're looking for is not the classification research, as you said, or even the field of research, because we already talked about the fact that it doesn't have to be ophthalmology. But there's a tendency, I think, among the applicants to feel like they have to have some research on their application to fill a hole. But a perfunctory effort at research usually, can be detected by the way people describe their project, by the nature of the project, by the letters written by their preceptors. And what I'm looking for is the depth of participation more than just the presence of participation. And that could be really in any type of research, from epidemiology to basic research to description of surgical techniques, for me, the genre doesn't really affect my interpretation of the effort or the passion that went into it.
And one more thing, when we're talking about like scholarly project, it doesn't have to be research. It could be a review article. It could be an article in the magazine. You just want to show that you're committed, you've done something extra. And I think that just helps to make you a stronger candidate for potential residency spot.
And more than that, hopefully it helps you in the field. You know, to me, what's the most important thing Sarwat said is that we're looking for passion. You know, ophthalmology residency is hard. In the field, you know, you're going to take on profound responsibilities for your patients over your career. And so it takes an incredible amount of effort on your part and our part to get there. And if you don't eat and drink and breathe ophthalmology and just, you know, go to night every night dreaming about being an ophthalmologist, the training is going to be tedious for you and you're not going to do well. So hopefully those research experiences are not, you know, they have maybe a side effect of having something to write on your application, but hopefully it's been an experience that, you know, prepares you and fills you with the true passion for the specialty, because that'll not only get you in, as Sarwat pointed out, but it'll get you through and it'll get you into a productive career where you can make a difference in the world.
And I just
Okay.
want to go
We have
back to your, sorry.
Oh, that's okay. We have 1 minute left, so you can make that comment, but I wanted to also get you both to weigh in on, you know, ophthalmology is not a core rotation, I think, in any medical school. So how did you get exposure? How do you recommend students get exposure if they're interested in ophthalmology? And then we'll wrap up.
So I did an elective when I was a second-year medical student. So I started early. If there's no official elective, if they have free time, they can actually just come and shadow, just approach any attending and shadow in their free time, just to get a little exposure, and then they can do a more official elective when time allows.
If there's an attending, Vanessa, in some medical school who doesn't light up when a good student walks in and wants to do work on her research project or, you know, shadow her in clinic, I don't know where they are. I don't think they exist. Right? That's usually a pretty easy thing to do, but you have to have the initiative to do it.
Okay. Fantastic. Dr. Salim, did you want to return to the one other point?
Yeah, I just want to say that when students do research, it definitely helps them to become more attractive candidates. But during residency, I also encourage my residents and fellows to do research because we're trying to develop future leaders. And many residents and fellows after their training may decide to go into academia. And I think it's important to have that background